welcome everyone. Thank you so much for taking time out of your day to join us for NeedyMeds special topic webinar, the importance of kidney health for people with lupus, presented by the Lupus Foundation of America. My name is Carla. I'm the Director of User Engagement at NeedyMeds. And before we get started with the presentation, I'd like to go over a few points so you can make the most out of it. First of all, if you do have questions, you can type them into that questions section of your GoToWebinar control panel at any time. Just know we will reserve answering questions until the end. If we don't have the time to answer your specific question, we will follow up with you by email. But of course, we will also provide the contact information for both the Lupus Foundation of America and NeedyMeds if you have to get in touch with us right away. And we encourage you to do so. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can find copies of both of the PowerPoint slide decks we'll be using in the presentation, as well as other materials we thought you'd be interested in that handout section of your GoToWebinar control panel. So let's jump right in with what is NeedyMeds. Now, for those of you not familiar with us, what you're looking at on your screen is our mission statement, a statement about how we achieve that mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our helpline, 1-800-503-6897, and our website, needymeds.org. What you're looking at now is our homepage. And I really like to put that up because our website is the face of our organization. And as you can see, it's full of information, so I want to encourage you to browse the site further when you have time. For now, I'd just like to point out a few resources. If you are looking for healthcare savings programs, you'll begin your search with the Healthcare Savings tab. The Education tab is where you will find our educational information and where you can sign up for webinars, our monthly newsletter, and order brochures, for example. I did mention that today's webinar is being recorded, and you will be available to find that recording on our YouTube channel. You'll find a link to that on the top right hand of our homepage with the rest of the social media icons. It's the third one from the left. You can also see other upcoming webinars and register for them on the calendar of events on the bottom right hand of our homepage. So as you just saw, an important part of our mission is educating people. And of course, we do that by educating people about NeedyMeds and the resources we offer, but we also fulfill that part of our mission by educating our users about other reputable organizations and the helpful and up-to-date and current information and resources they offer, which is why we are so pleased to have our partner, the Lupus Foundation of America, here with us today. So before I introduce our guest, Lauren, I want to tell you just a little bit about the Lupus Foundation of America. They are the largest publicly sponsored lupus organization devoted to solving the mystery of lupus, one of the world's cruelest, most unpredictable, and devastating diseases. Through a comprehensive program and research, education, and advocacy, they lead the fight to improve the quality of life for all people affected by lupus. And the expert we have here with us today from the Lupus Foundation of America is Lauren Metelsky. Now, Lauren is the health education nurse manager with a background in nursing and a master's degree in public health. Her team at the Lupus Foundation of America serves people with lupus every day, providing health education and resources for people living with lupus. Today, Lauren is going to specifically talk to us about the importance of kidney help for people living with lupus. So, without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Lauren. That'll just take us a moment. And as Lauren is grabbing that screen, I want to remind everybody once again that if you do have questions, you can go ahead and type them into that questions panel of your GoToWebinar control panel. And with that, I'll go ahead and pass the mic to Lauren, and enjoy the presentation, everyone. Thanks so much.
Thank you. Thank you so much, Carla. Thank you everyone for being here today and taking time out of your probably Zoom-filled day to attend a webinar. I really hope that you find some important things really helpful to you during today's talk. We have a lot to cover. The kidneys are extremely important to people with lupus, but I have had a cup of coffee, so I'm ready to go through it, and hopefully we can get it all in here in the hour's time, okay? So we're going to talk a little bit about the importance of kidney health for people with lupus. Today's discussion, we are going to talk about what are the kidneys? What is lupus nephritis? Who treats lupus nephritis? How do they do it? What are some lupus nephritis resources? And I will point you to some that we have at the Lupus Foundation of America. So first, what is lupus? I know that some of you probably know, and that's why you're attending this session, but just in case anyone out there is still kind of new to the world of lupus, I want to give you a little bit of background. Lupus is a chronic autoimmune disease, and it can affect people of all ages. Chronic means that it lasts pretty much the entire lifetime. I mean, anything that's chronic could be something that is lasting longer than 6 months, but with lupus, what we know is there's no cure yet. It doesn't go away. It can be managed though. It's autoimmune, which means that it is a disease where the immune system creates autoantibodies that whenever it's activated, will actually attack the body. It can affect people of all ages, but we know that it affects women more than men, and it can be diagnosed during the ages of 15 to 44. It can be diagnosed outside of those ages, but that's kind of the primary age range of when people are diagnosed. And it's also more likely in women of color. Lupus can affect any organ in the body, such as the skin, the joint, the heart, the lungs, and the kidneys, which is why we're here today. So if you are thinking that you might have lupus, if you have questions about the basics of lupus, I really recommend heading over to the website, lupus.org/resources, what is lupus? There are a lot of facts and stats on our page, lots of ways to understand how lupus can affect people differently in different organs of the body. So it's a great place to get started. But today we're going to focus on the kidneys. So I'm going to talk about what are the kidneys and how do they work? So here we go. Here are the kidneys. This is an artistic depiction of the kidneys, but I think it's a lot prettier than putting a slide up of an actual kidney. So we're going to go with it today, okay? So the kidneys are a pair of organs that are found under the ribs. You have one on each side of your spine. Oftentimes, people who have kidney pain will actually experience it in their back or in the sides of their abdomen, not in the front, not in the stomach region, really kind of the back and the sides, because that's where they're located. We have two kidneys, but as we'll talk a little bit more about later, the body can function with one kidney, but it's great if you've got two. So the kidneys are part of the renal system, along with the bladder, the ureters. Those are the tubes that carry waste out of the body, along with the urine. There are nerves carrying messages to the brain and tell the body how to work and how the kidneys should work. And there are veins and arteries which carry the blood and the blood products in and out of the kidneys. But the kidneys are the primary organ of the renal system. And they're really responsible for very important things in the body. They are responsible for maintaining the correct amount of fluid in the body, the right type of fluid, the right amount. They're also responsible for removing waste products and the toxic substances that we put into our bodies or that are just, we don't know are in our bodies. The kidneys keep us in a really healthy balance with that. And they're really important in regulating the hormones of the bodies to help control our blood pressure and the blood volume. So here again, we see our cute little kidneys. Within each kidney, there are 1 million nephrons. Okay, so we're going to get a little bit of a deep dive into the anatomy here, so hang with me. In each of the kidneys, we have 2 of them, there are 1 million nephrons. And inside each nephron is a bundle of vessels known as the glomerulus. The glomerulus is the filter of the nephron, and it helps to filter out the excess fluid and waste and things that we just talked about, to keep the balance, to keep the toxins out. They are working hard in the kidneys to make sure that balance is there. The glomerular filtration rate, GFR, is a calculation that tells us how well the glomerulus are working and filtering out the blood. And it helps doctors to tell us how well the kidneys are functioning. Most people don't have a GFR lab test done unless there is some indication that there might be kidney involvement. So hang on to that term, we'll come back to it later, but that's just how we can kind of see the functioning of the kidneys. The well-functioning kidneys can actually filter out 150 quarts of blood a day. So they are the workhorse. They are a powerhouse of the renal system, working hard for you every single day. So what is lupus nephritis and why are we talking about it? So with lupus, there is involvement, there's possibility of involvement with the kidneys. Remember we talked about lupus can involve any organ in the body? Well, lupus nephritis is the shorthand term for glomerular nephritis or inflammation of the nephrons. Remember we talked about that in the previous picture, in our cute little kidney picture. So inflammation in the nephrons. Lupus nephritis is the term that's used when lupus causes the inflammation in your kidneys, making them unable to properly remove the waste from your body or control the amount of fluid in your body. Again, pointing back to the main function of the kidneys. So when lupus is inflamed, which is whenever there's a whole lot of activity in the body, those autoantibodies are revving up and they're causing havoc in the body and they're attacking your skin or your joints or maybe your kidneys. When that inflammation is in your kidneys, it makes it really hard for those kidneys to function. And if they can't function, then they're not filtering out, they're not keeping the balance, okay? This is really important for people with lupus because studies show that lupus nephritis happens in up to 60% of people with a lupus diagnosis. We know that it's more severe in minority populations and with childhood lupus because there is just higher inflammation that is associated with lupus when it's diagnosed in children. And we know that 30 to 40% of people diagnosed with lupus will have lupus nephritis at the time of their diagnosis. So I'm going to repeat that. 30 to 40% of the people who have lupus will have lupus nephritis at the time of their diagnosis. So there is a percentage of people that will later go on to develop lupus nephritis out of the whole of people with lupus. And that usually occurs within the first 5 years. Okay, so this is really important for people with lupus, and it's really important that people with lupus understand why kidney health is important, so you can be watchful of the early signs and symptoms and the discussions that you need to have with your healthcare team to get on top of any kidney involvement early on. Okay, a lot of times people will establish care with a nephrologist who is a kidney doctor early on in their lupus diagnosis so that they can get a good baseline of where are their kidneys at, what are they doing, how are they working. So when someone has lupus nephritis, antibodies and proteins deposit in those filtering units. So this is the breakdown of how they affect the kidneys. Here's a picture here from before where you can see that nephrons were circled and then the glomeruli are in the middle. That filtration system is in the middle of that little circle. So when they get bogged down and they poorly filter, it affects that glomerular filtration rate. So that tells us how well the kidneys are functioning. But when the antibodies and the proteins kind of get clunked up in the nephrons and the glomeruli, then they don't give us a really good GFR. Okay, it tells us, okay, wait a second, I'm a little bit bogged down, my filter's not working. I kind of think of it like a coffee filter that's not doing its job. So if you have a coffee filter and it's not doing its job, when you get a cup of coffee, you're gonna have a lot of grains in it and it's gonna be just no good, right? Think about the glomeruli like that. It's a bogged down filter, it's not doing its job, and it's going to spill things out through the urine. So when you get those tests later in the doctor's office, they'll be able to see some of those waste products, but they're also going to see some of the things that shouldn't be there. But, you know, we don't all have urine dipsticks lying around the house, so we can't go and check our glomerular filtration rates. If we're feeling, you know, like we've got something going on with the kidneys, or if we're concerned about the kidneys, it's not something you can easily do. So we're going to talk a little bit also about some of the signs and symptoms of kidney involvement that you want to become aware of. A lot of times people with lupus nephritis or kidney involvement will experience sudden and unexplained swelling, usually in the feet, the ankles, the legs. Maybe this is experienced by shoe indentation marks in the evening. When you get home, you take off your shoes, you can, they've swelled throughout the day. Sometimes in the fingers and the arms, or in the face and around the eyes. So swelling is one of the symptoms that you might look for, but swelling can happen for other reasons, so let's keep going. Another thing that you might notice is blood in the urine. Now, blood in the urine isn't always visible to the naked eye, so you may not catch this, but keep your eyes, keep a watch on your urine changes. If there is any urine change, that's when you would need to go to the doctor and let them know, hey, there was this change in my urine. And then they might be able to take a blood sample and check it out. I mean, a urine sample, sorry, and check that out. Maybe there's a foamy appearance to your urine that you've noticed that wasn't there before. An increased urination, especially at night. Maybe elevated blood pressure. So the normal blood pressure is 120/80, but we know people tend to vary along a spectrum. So you have norms probably with your doctor. They can go back and they can see your blood pressures over time. If you're starting to have any feelings of a racing heart or being flushed, or even that increased swelling in your legs, talk with your doctor about, okay, do we need to come, get more regular blood pressure testings to see if there's a change in the pattern that you've had before, whether or not it's 120/80. Is it a change in your baseline? You may want to, they may instruct you to keep a log at home at different times of the day where you can kind of compare. So these are some of the things that we might want to keep an eye on if you've got lupus, or if you think you might have kidney involvement. So whenever you're looking at these things, we'll talk about a little bit later what to expect at the doctor's visit, so that you guys can have the most productive conversations. But I will say, if you are preparing to have those conversations with a doctor about your concerns of kidney involvement, I would recommend that you maybe download our lupus symptom tracker, and you can kind of date the times and what was happening whenever you notice those new symptoms. So maybe you had swelling in your legs and it was associated with something specific. So it's another really good opportunity to use as a conversation tool, and that's the lupus symptom tracker. It's downloadable on our website and our information packet, and I also think that Carla put it in the handout notes as well. So we know what potential kidney involvement can look like. Now, who treats nephritis and how do they do it, right? First of all, let's just back up for a minute and let's say, who treats lupus? So most people with lupus are going to see a rheumatologist. If there's a good rheumatologist available, this is a doctor who treats people with autoimmune diseases like rheumatoid arthritis, with lupus, and they're going to be very skilled at understanding and anticipating what labs need to be done and things that need to be watched over time to keep your inflammation down. But there's not always a rheumatologist available, and sometimes people have great relationships already and great rapport with some other physicians. So I just have a list here of potential people of where to start if you start to notice any concerning symptoms. So if you go to this doctor and you tell them, hey, I've got some concerns. I've noticed my blood pressure is up. I've got some swelling in my legs. I'm concerned about kidneys. You're going to go here, and they are probably going to send you to a nephrologist. And a nephrologist is a physician who is a specialist in treating the renal system. They'll go and they'll want to look at your kidneys, and they want to hopefully get early diagnosis so they can get proper treatment of lupus nephritis. What we're really trying to avoid is end-stage renal disease. Now, there's a whole spectrum of disease with lupus nephritis, which we'll talk about in just a minute. But the main goals are to reduce the inflammation, reduce or stop the inflammation so that your kidneys don't get to a scarring point where they can't function or they can't be recovered back to a functional state. Okay, so remember that we have up to 60% of people with lupus who will develop some kind of kidney disease. It doesn't mean that everyone's going to end up in end-stage renal disease, but it means that it's important to establish care with a nephrologist, to have these conversations and to assess your risk for further kidney involvement. So a lot of these tests, like we talked about, can be done with those other providers. It can be done with your family physician. You could have the creatinine test. Those can be done in blood test. You may have those proteinuria tests, which are done in a urinalysis. Physician may want to do a urine collection for 24 hours to see if you're, what kind of things you have going on in your kidneys over a longer period of time rather than just like a one-stop test. Again, physical assessments. But, these can tell us some things, but it cannot tell us about the level of kidney involvement. And so if a physician is concerned enough, if a nephrologist thinks, we got to see what's really going on in the kidneys, it's likely that they're going to recommend a kidney biopsy. I don't really have a slide on this, but for a kidney biopsy, it's usually an in and out one-day procedure where you were going to lay down on your stomach, and the portion of your back where they are testing will be numbed. They use a ultrasound guided needle to take a tiny sample of the kidney so that the physicians can look at it and determine if there is a lot of scarring, what stage of lupus nephritis that you have. This is a classification that they use, what that pattern looks like. And this will help them to understand what stage you're in or what class that you have, but it will also help them to determine what kind of treatments are necessary. And this is an extremely complicated process, and it's not the same for each person. So it's definitely an involved conversation you want to have, an open conversation with your nephrologist if you're going to the biopsy, and understanding where you're at and what those treatment options are. So, like I said, it is classified according to the biopsy findings into 6 major types or classes. The 6th class is going to be the one with a lot of scarring that's hard to come back from. But along that, the other classes, there is potential for medicine treatment, aggressive treatment in some cases that can help to recover some of the kidney functioning so that it can filter and it can maintain that fluid level, keep those toxins out of the bodies. Injuries to the kidneys are also labeled after biopsy as active or chronic. Again, and really what we're trying to avoid is that end-stage renal disease. So the treatments for lupus nephritis are typically really aggressive early on, depending upon, again, what class that you're assessed to be in. A lot of times it will be with high-dose prednisone or other steroids, which are quick to stop inflammation. So this might be given like an IV in a pulse, like a high dose, but they also want to start you on some immunosuppressive drugs. These can be used with or instead of steroids. And typically the thinking is to hit it hard early on, get that inflammation down, get those immunosuppressants on board, get the body's response to it to see if it's working. And if it is working, then physicians will want to back down on the steroids. That's really the hope, is so that you might go on to take those immunosuppressive drugs for a year or so, but the thinking is really to stop that inflammation so that it doesn't progress into a state of scarring that is harder to come back from. It's important to note that even with the proper treatment, patients might relapse in their kidney disease. So continual follow-up is extremely important with your nephrologist. I think it's a great idea, if it's possible, to see nephrologists and rheumatologists who have a history of working together so that the communication is happening, because you're going to be taking really aggressive treatment for your lupus nephritis, but your rheumatologist may also want to make sure that you're seeing a cardiologist or a dermatologist for some of the other concerns that you have with lupus. And so it's really important that these physicians are able to work together, or that you are really great at getting your medical documents back and forth to where they need to go at minimum. The proper assessment by the nephrologist is key to getting the right treatment for your treatment program and staying on your treatment. So again, honesty is extremely important, making sure you're having a great conversation with your nephrologist, letting them know if you have any concerns with the treatment, not stopping the treatment, but really being open about the conversation, remembering that you share a goal, and that's to stop the inflammation in your kidneys so it does not progress. There is a lot of treatment that is research that is going on in the lupus world, and we are so excited at the Lupus Foundation to be able to partner with people or to work with the researchers who are doing some amazing discoveries in lupus. And so we actually have a place where you can go to get lupus news. And I want to be able to share those resources with you all so that you know where to go to get more information as it's being delivered to the public. We don't want you to miss anything. So one of the most exciting things that has happened recently is the approval of Benlysta, which is a known drug, first developed in 2011 for treating lupus, but in 2020, it was also approved for lupus nephritis. So this drug was previously approved for lupus, but they didn't have all of the data to support its use in people with kidney involvement. But we are really excited and celebrate that now it has been approved for people with kidney disease. And this is just another treatment in that arsenal for people who have lupus so that you can live better and hopefully get those kidneys in a healthier state and give you just a better life. You can see at the bottom of the screen that I have a link to where you can see some of that research news. So just be mindful of these links. I know this will be recorded, jot them down, bookmark them so that you can come back and see what else is around the corner. So again, here's a few more links of recent developments, different articles that have been dropped about lupus nephritis in the news. I would really invite everyone to sign up at lupus.org/subscribe to get these lupus updates so that you don't miss a thing. So I'm hopeful that today you learned a little bit about the kidneys, and I am, and you at least understand that it's an important part of your lupus care. Whether or not you now have kidney involvement, it's a conversation to be had if you haven't already with the doctor who is overseeing your lupus care. But we have abundant other resources available on our website that are interviews with expert nephrologists. They are programs for people with lupus, support, all kinds of things that I really wanted to direct you all to so that you know where to go to get more information, continued information, and know that we are here for you. So for programs and services, you see the link, health education specialist. My team at the Lupus Foundation of America can be reached via email on our website, or you can give us a call. We work alongside so many experts in the lupus world, and so we get a lot of calls from people who are looking for answers, and we may not have all the answers, but we will dig for you and we will find you the education and resources that you are looking for. Hope to connect you with people who might be able to answer your questions as well. We also have some information on our website and our resource center on kidneys, some FAQs about kidneys, information about kidney transplants or dialysis, things that you will want to know. There is a whole wealth of information there. We have a really nice web page that is up now, What is Lupus Nephritis, that has tons of links out to even more information. So you can fall into this rabbit hole and just keep digging through all kinds of information. You're just going to learn so much. So I wanted to make sure to direct you to this as well. So after you've learned all this, the question is, what can you do? So if you've been diagnosed with lupus, it's really important that you ask about your need to establish care with a nephrologist. Your lupus may be a case of cutaneous lupus or discoid, where you're not having organ involvement at this time, and your physician might say, keep me apprised of any changes. We're gonna just see how it goes. Let me know if you have any concerns. And then again, your physician might say, absolutely, establish care with a nephrologist. Let's get your kidneys assessed immediately. And this really is because lupus can affect people so differently. So it's important to establish care with a primary provider who is going to look over your lupus care and make the best recommendations for you. You can stick to your lupus treatments. So there are treatments for lupus. You can look through them also on our website, lupus.org. There are lots of treatments for lupus that can keep that inflammation down. One of the best things that you can do is stick to your treatment. Your physician may have also asked you to make some lifestyle changes. And so maybe that means checking on your blood pressures, doing things to reduce your blood pressure. Maybe that is something with your diet. Maybe they want you to reduce some salt intake. Maybe it's stop smoking. So there are also lifestyle changes that your physician may recommend that will keep your inflammation down and protect your organs. And sticking to those is a big part of taking care of yourself and giving yourself the healthiest chance with your kidneys. So if you have any questions or concerns, like I said, please do not hesitate to reach out. This is a link to where the health educators are on the website. You can send us an email. We can get you the answers or guide you to the answers. And you can also look at some of our programs as well. We have the Expert Series, which is a podcast series now where we interview experts. There's a support system. We have some local support. We also have an online support community and just abundant library of resources as well. So if this piqued your interest and you want to learn more, go to lupus.org and check out what we got there for you. And I can't believe it, but we got through all of that in 30 minutes. So I guess I'll give it back to you, Carla, to see if anyone has any questions.
Lauren, thank you so very, very much for that thorough presentation. And before I dive in myself, I just want to make sure that everybody is seeing my screen. It's still just a picture of you up there, Lauren. Do you see that?
Yes, I do.
Okay, great. So yeah, a big thank you to Lauren for sharing her expertise with the NeedyMeds audience, and to our audience who I can see is listening intently and participating, because we do have a bunch of questions and comments coming in. I really want to stress that one of the reasons we were so excited to have Lauren do a presentation for our NeedyMeds friends and users is because I think she really drives home what the Lupus Foundation of America is all about. You can see her passion for helping people, you can see her expertise. But one of the things I find most helpful is the Lupus Foundation of America, the way they go about sharing information is they can take a really heavy topic, something that might be confusing and overwhelming, break it down into understandable chunks. And make it so that we can understand not only what the topic is, what lupus is all about, but how to care for ourselves. You'll also find, Lauren talked about the website and showed you some really great resources they have. You'll find that their website is really easy to navigate. So take the time when you have it to really peruse that website, because you'll find a ton more information about how to take care of yourself if you, a loved one, a patient or client is living with lupus. So keep that in mind. Again, if you do have questions, you can go ahead and submit them. I know many of you already have, into that questions section of your GoToWebinar control panel. And as we get to those, as I give you a chance to submit some of those coming in, I do want to remind everybody that NeedyMeds is also here as a source of support, in particular if you are having difficulty affording your health care expenses, including but not limited to your medications. What you're looking at on your screen are all of the cost savings resources that you can find under needymeds.org under that healthcare savings tab that I pointed out in the beginning of the presentation. I'm not going to go into these right now, but I just wanted you to know that they do exist. And importantly, I want you to know that if you do want to learn more about them, not only can you check them out under that healthcare savings tab, but you can join us for some of our overview webinars or our webinar briefs where we do deep dives into specific programs. And you can check out, again, those upcoming webinars under the Education tab next to that Healthcare Savings tab, or on the bottom right calendar of events. And of course, speaking of upcoming webinars, there are some of the ones coming up in the coming weeks. I really encourage you to join the Becoming an Empowered Patient webinar. And you can see that the next couple after those are exactly what I was talking about, some deep dives into NeedyMeds programs, specifically about our prescription assistance programs and how our drug discount card can help you save on your medications and other healthcare costs as well. So again, if you do have questions, you can type them into that questions section of your GoToWebinar control panel. Again, if we don't get the chance to answer yours, you can certainly reach out to the Lupus Foundation of America or NeedyMeds, but of course we will respond as soon as we can via email. And I want to leave up the important contact information for Lupus Foundation of America as we get to those questions coming in for Lauren. Again, you can find a copy of my PowerPoint slide deck and, more importantly, Lauren's slide deck in the handout section of your GoToWebinar control panel. So let's get to some of those questions coming in. Let's see. What are some of the questions coming in? Well, one of the things that I wanted to ask is, so let's see. Bear with me just one moment because I'm having a little bit of technical difficulty here, so just bear with me. One of the questions that I'm going to throw out to Lauren right now is, can lupus in early stages have any hair loss as the only symptom? So I'm going to give Lauren a chance to answer that. And in the meantime, bear with me, everybody, because I'm having a little bit of tech difficulty on my end. But go ahead, if you can shed some light on that, Lauren, that would be a huge help. Thanks, everybody.
Sure. Yeah, no worries. So yes, lupus can have a wide spectrum of symptoms and concerns. So hair loss is one that a lot of people with lupus will have. Sometimes it comes out like in patches. So if you're starting to have hair loss, I would say talk with your doctor about it. There are a lot of things that can cause hair loss. It's been a particularly stressful year, so stress can cause hair loss. But with lupus, hair loss can happen either kind of generally you're just shedding hair, or like I said, kind of in patches. And if it is in patches, something that you can kind of look for on the scalp is if you're having any scarring or kind of discoidal or circular patches of like red, irritated skin. And if you're having that with the hair loss, there's a good chance that you would need to follow up with, say, a dermatologist or even just your regular doctor to see if it might be lupus related. It's hard to say if just hair loss is a sign of lupus, just because so many things can cause general hair loss. But again, like that's definitely something you want to bring up with your doctor. And I tend to say, because lupus can look so different in every person, when you're going to the doctor, if you have your concerns, write them down. We all know that those visits in normal years seem rushed, but it's hard to prioritize your concerns. So if you start to have one or two symptoms, go to lupus.org and you can look at the signs and symptoms, and it might jog your memory of some of the other things that are related to lupus that you will want to bring up in that doctor's visit that will help to kind of paint a picture of your health. In addition, if you're just starting out with hair loss and there's nothing else going on, but you have a really strong family history of lupus, while we know that lupus is not, it's not purely a genetic disease, there is a slightly increased risk if you have family history of lupus. So, kind of painting that picture will be helpful as well. One of the first things your physician will probably do is, get your health history. They may just run a panel of labs and just kind of see basic inflammation or lupus panel to see if there's anything that pops up. And if you have not a whole lot of symptoms, it's a pretty good chance those will come out clean. But again, if it is something that is causing changes to the skin on your scalp, I would definitely seek maybe a dermatologist even. They can biopsy that skin, and that could also be really helpful in determining if it's related to lupus.
Thank you so much, Lauren, and thank you to our audience member for participating. I apologize for the technical difficulty. For some reason, I wasn't able to see the questions coming in from the audience, with the exception of two, and Lauren already answered one of those. So thank you to our audience for participating in the question and answer session, because I say this almost every webinar that I feel like if you're in the audience and you have a question, please ask it, because the chances are that somebody else is thinking about it as well. So now that I could actually see the other questions coming in, the next one, and I think this is a great one, and it's really germane to the topic today, which is, if I'm newly diagnosed with lupus, do I really need to worry about my kidneys already?
Yeah, that is a good question. So if you're newly diagnosed, well, chances are if you're newly diagnosed with lupus, you're worried about a lot. um, because when people get diagnosed with lupus, it's typically because their symptoms are so overwhelming that they're able to be diagnosed. A lot of people go undiagnosed for a long time. We did some recent look into this, and it can take an average of 6 years to be diagnosed with lupus, but that's after years of having questionable symptoms. So chances are, if you're diagnosed with lupus, you've got a lot on your plate. So should you be worried about your kidneys? Um, let's say you should be having conversations with your rheumatologist, who is kind of the team captain of your care, about what their biggest concerns are for you. So depending upon how you come to how your assessment is at the doctor, what your lupus looks like, they might determine that you need to see specialists from the get-go, get a good baseline, establish care in case you need it for later. But in other cases, they might say, let's just follow up with me. Let's start some medication. Let's get this inflammation down. Follow up in 3 to 6 months, see if the medication's working, and then see if you're still having the concerns that you have or whatever. But again, if you are coming to the doctor, I know you're stressed. I know if you just got a new lupus diagnosis that you are just have a lot on your mind. So I would say don't worry, but be diligent to be an active participant in your healthcare. And if you're newly diagnosed, there's also a newly diagnosed email series. If you go to lupus.org/services, you'll see there's a take charge email series that will really break down some of the important things early on in a diagnosis that you are pursuing with your healthcare provider, so that you can be in full management of your lupus care. So don't worry, but be diligent. That's my answer.
Good and really good and thorough answer. Lauren, you also talked about when we go to the doctors, and when you said before that the rheumatologist is really the team captain of your care. It reminded me of just a few other resources I wanted to share with our audience. NeedyMeds also hosts BMedWise. That's bmedwise.org. And on there, you can find tons of information about how to prepare for an upcoming doctor's appointment. It takes into consideration the suggestion that Lauren made, which is to write down your questions and think about it before you go. But do check out BMedWise, and also join us for that upcoming Becoming an Empowered Patient webinar, because I think it can also help you to prepare for upcoming doctor's appointments. So I just wanted to throw that out there. So another question coming in, Lauren, is, and this you probably get a lot, I would imagine, is a biopsy the only way to properly stage kidney disease?
Yeah, that's a good one too. Yeah, so yes, as far as I know from the physicians that we've talked to, I've never conducted a biopsy. It's not my expertise, but from the physicians that we talk to and the experts in the field, yeah, a biopsy can give them a really good look at what that tissue looks like. Is there scarring? What is the pattern? How much of a sample might be involved? So it can really help to determine how aggressively they need to treat the lupus nephritis. I know it's not, no one wants to go in for a biopsy. It seems very daunting. So as a health educator, my advice would be, make sure that if you're being recommended to have a biopsy, make sure that you understand how it's being conducted. Make sure you ask all the questions of the doctor so that you feel confident going into it, that you're making the right choice, and you feel empowered by the decision to get this piece of information so you can get on a healthier track. And if it takes you a day or overnight to think about it, take questions home, make some more questions, send it back to your doctor. Just make sure that you're fully informed about it. It is it's a procedure that is done often. So it's something that is pretty common for lupus patients, and definitely in the nephritis world. So, yeah, it's really the best look at the kidneys to get a sample of them. So unfortunately, something invasive is the best we got right now.
Thank you so much. Um, The next question, I'm really glad somebody asked this because it gives you an opportunity to drive home the resources Lupus Foundation of America has. And the question is, where can I talk to others with lupus nephritis?
Oh, I'm so glad that you asked. So we have a few different places where people can connect, because gosh, even in a normal year, I feel like we all want to connect online because sometimes it's hard to show up at an event. And so a few years ago, prior to our online life, we launched a partner inspired, we launched a online support community called Lupus Connect. And it's a great place to go and find other people. There are, gosh, 14,000 members worldwide with lupus who are connecting all the time. And so it's a great place to find other people, ask, about their lupus nephritis, ask them, how are you feeling? How is your treatment working? Kind of getting some feedback from people who are living with lupus nephritis or lupus in general. Another great place to connect is on our website. If you go to lupus.org/advocate, we actually have a summit coming up, an advocacy summit. This is the second year we're doing a virtual one, and it'll be a really awesome opportunity to go to a 2-day just information explosion on research and advocacy for people with lupus. And right now the window is open to register, so I encourage everyone to go. I'm sure there will be so much more information there that is shared about lupus and lupus nephritis than you ever knew that you needed. And it's a really great place to also meet other people who are there to advocate for themselves or family members. And it's an incredible energy there. It'll make you feel a part of the community that you are. So there is also we also have support groups that are done by our chapters in our national office. So you can get local at lupus.org, go to get local, and you can find your local support groups. Even this year, when we're all online, there are options for connecting with people virtually in your area. So I think we have a few options there, and I really hope that if you are feeling like you need to connect with someone, that you seek out those options. And again, you can always reach out to a health educator. And so go to lupus.org/health educator, and we'd be happy to chat with you as well, and hopefully try to get you connected as well.
Thank you so much, Lauren. We're going to go ahead and wrap up today's webinar. I know that there were questions coming in that we didn't get the chance to answer, and I do apologize for that. But again, we will follow up with you as soon as we can via email. But importantly, don't hesitate to reach out to the Lupus Foundation of America directly at the contact information on your screen. And of course, the contact information for myself and NeedyMeds is at the bottom of that screen that you're looking at right now. A huge thank you again to Lauren for sharing her expertise. We are thrilled to have the partnership of the Lupus Foundation of America because they have such current and up-to-date and useful resources that you really can't get anywhere else. And a big thank you to our audience for not only taking time out of their day to learn a little bit more about this important topic, but for participating. So in addition to thank you, there are some action steps you can take, which are certainly, we encourage you to go to the Lupus Foundation of America and check out that website further and connect with them. Lauren pointed out some really helpful ways and hopefully easy ways that you can connect and not only educate yourself further, but get in touch with people that are experiencing the same issues you may be, and certainly community members that are also living with lupus. So there's, as Lauren said, hopefully you'll find a community that has great energy, and you'll be able to take advantage of all that means. The other action steps you can take certainly are staying in touch with NeedyMeds, following us on social media, and hoping that you register for some of those upcoming webinars that I pointed out. We do have webinars on our calendar events through the end of the year, so keep that in mind. So again, you can find our PowerPoint slide decks in that handout section of your GoToWebinar control panel, and we do hope to see your name pop up in the future. And please stay in touch with the Lupus Foundation of America at NeedyMeds. With that, have a great rest of the day, everyone, and thank you so much. Take care.